Welcome to Face Values, the podcast where we peel back the layers of cosmetic surgery and skincare to help you understand how your skin is aging and what you can do about it. I'm Dr. David Jack. I'm a cosmetic doctor and skincare brand founder. I'm based in London. I've got clinics in London and Edinburgh. I've got a real interest in just understanding more about how the skin ages. So I'm going to be joined by lots of guests who are real experts in the field. So I hope you enjoy and keep tuning in. Welcome to Face Values. Today I'm joined by Georgios Orfaniotis, who is a facelift surgeon in London, and also with Salima today, who's going to help me interview George. So
thank you.
He is renowned for doing the Deep Plane Facelift. He's one of the first in the UK to do this. So tonight we're going to be talking about what does this actually involve and what you can expect from the procedure. George, you are a proponent of the Deep Plane Facelift. You've been doing this for a while. One of the few in the UK, I believe, that offers this treatment.
Yes, it becomes a bit. Thank you for having me. First of all, it's very good to be here. So yes, I was one of the first to start doing them. I wasn't the first. I'm not claiming that, but when I started doing them, even in central London hospitals, people were questioning. Why is this guy taking so long? What is it what he's doing? Like Deep Plane, why is this? He just does 5 hours facelift. And I had to explain why. And thankfully, with the social media and the increasing interest in people in treatments and surgery in particular, it became apparent that there is this particular technique which is called Deep Plane, and the Americans promoted a lot, which actually it's worth the hassle of going through so much surgery and paying an increased fee for that. And I thank the Americans for bringing that up, because I don't think in London we have much hope if it wasn't for them.
So where did you learn about this, George?
I think my background has helped. So I'll just tell you a little bit about my background. I was a head and neck reconstructive surgeon. So I did a lot of work on patients that they had head and neck cancer. And I was reconstructing them, so putting things together. And I did 2 fellowships. I went abroad in Taiwan and in Australia. So I spent a lot of time also in the UK doing that. And as a consultant, I worked at Guy's St Thomas's in the NHS, and I was putting back people's faces. Therefore, I was confident with the anatomy and comfortable with the nerves. And therefore, when I started doing my private work, and I was thinking about doing facelifts because it was my area of expertise, this technique just suited my skill and knowledge, and I thought it actually makes sense. And I started practicing it from my first facelift. So my first facelift was a Deep Plane facelift. So I never did a SMAS facelift. And this is how it started.
Yeah. So for people who haven't heard of the Deep Plane facelift, so there's the kind of more traditional facelifts, which are starting from very simple procedures to much more complex, obviously. So what is the difference?
Yes, what is the fuss about? So essentially, with the Deep Plane, you are diving under the deeper layers of the face, whereby facial aging occurs. Facial aging is not on the skin. Skin is just following what the deeper layers are doing, and it just stretches because the deeper layers are stretching. Therefore, older techniques such as the SMAS plication, and just to give people an idea, what is the SMAS? SMAS is the layer of the tissue. It's a bit muscular layer and continues on the neck, and it's also known as platysma in the neck, which is found under the skin, just immediately under the skin. And this is the layer where most of the changes occur on our face, and this is what we target. Therefore, by targeting this SMAS layer just superficially only, and lifting the skin and just putting some sutures to just pull it, there were limitations to it, and there were some results where they were not good, because you're actually just pulling a little bit of the skin and a little bit of the SMAS, and you were going against some fixed points on the face where there was too much tension, and that was obvious. And you were having these results with a windswept tunnel, and you were having some obvious lines on the face where one side was pulled and the other was not. Now with the Deep Plane, you don't need to lift the skin off. you just go deep and you're releasing all these fixed points on the face. Therefore, the whole SMAS layer, which is, as we said, the responsible layer of aging, it just can reposition in a natural way, and you're restoring the position that you actually have when you were younger. And it just gives you this natural effect because it's a uniform and a smooth transition of the tissues to a lifted area.
But George, the recovery sounds like it must be crazy.
Oh, it is. It's not crazy, but it's not a walk in the park, and it's definitely very involved. And this is where people also need to invest, because it's a big decision. You accept the scars, you accept that you're going to pay more money because it costs more, but you also need to accept that you're going to be 4 weeks. You're not going to be presentable. Some people are luckier and they just recover a bit quicker, but you'll be surprised that some of the people, if they expect what's happening, they're fine with it. I think the bad things happen when you don't actually let people know, or you're feeling a bit guilty for or you worry that they're going to run away if you tell them that actually you have to take this time off, or you show them the picture. So when people know the real deal, they're happy to accept it. And I would say out of the 10 patients, I'll say 3 they will describe it as a minor inconvenience, and I heard that from the patient and I loved it. It was a minor inconvenience, and I wish I could say that. But 3 out of 10 they will say that I actually didn't need painkillers after day 2. So 2 patients, they're going to really struggle. They're going to be the patients that they might have a little bit of nerve recovery, that it's a big week, and they're going to say that actually I was this unlucky patient that took a bit longer, and they might have some setbacks during the recovery, not major complications, but just a lot of swelling. And usually these are the patients that did not really hear what you're saying, did not really read the information, and they just turn up and they say, oh, I was looking forward for that to get some sleep during my anesthetic because I'm not sleeping for a week. And okay, I know that how it's going to end up. And then you have another 5 patients that they are the average patients that you like to 4 weeks you're going to go to a restaurant and you're going to be fine to go to work after 2 weeks, put your hair a little bit down, and you're going to just have a smooth recovery, and this is how it goes.
Okay. And what sort of age or stage are people doing these now?
Well, that's it.
I know. This is what everyone asks me as well. When should I stop doing fillers? When should I?
It's a bit controversial, to be honest, and I say it depends. Yeah, of course. And I have done facelift on a 34-year-old patient.
Oh, really?
What?
Gosh,
it's not. I'm not really trying to advertise that, and I don't want all the 35-year-old coming for no.
Of course,
But there are some factors that you take into account, such as genetics, for example. Some people, you're not like fighting aging in some people, you're fighting genetics. And so there's some people that they had babies, they've lost a lot of weight, or they were just having a heavy neck since they were like teenagers. You see pictures. So in these people you might do this a little bit, which is more corrective surgery. On the other hand, you've got people that they're really like looking to have the face that they had when they were 25-year-old, and when they are starting seeing just even minor changes, they start worrying about it. And I think this is a category where it's a bit too early, and you really need to have the journey with a non-surgical, because the non-surgical treatments will give you improvements that they will last for some time. And you definitely worth doing that. And obviously I know that people now are like, oh, I don't want to put filler on my face. Well, everything in moderation and everything with judicious approach. Go to people that they understand, facial aesthetics, and you can have like years and years of treatment and you're going to look absolutely normal. If you just keep pushing filler, every 3 months because, and it's becoming difficult. But I say my sweet spot age is between like 45, 46 to 53. Sort of thing. I think you see significant changes that you can improve with surgery, and also you're not old enough to recover slowly, because it's a big surgery. So if you do it younger, I think you recover much quicker. But again, there are the limits. There's like extremes. As I said, a 34-year-old and then I operated on people that they are 80 years old and had like the fourth facelift.
Sure.
Wow.
Yeah.
And again, you have to judge how fit is this person, and if they're fit to go ahead with it, then that's fine.
Yeah.
George, how do you decide if someone has a lot of filler and Botox and they come to you for a facelift? How do you judge?
Yeah, first of all, Botox. I know there's a lot of chat about Botox recently. I mean, Botox is the most innocent treatment that you can have.
Yeah.
I mean, people say to me, have you had it? Well, I had Botox. I don't even... I'm not bothered.
Yeah.
As much Botox as you.
Yeah.
Only if you want to just do brows and eyes, maybe it's worth having a break so I can really assess what's going on.
Right.
But all these things about how bad is Botox, I don't really see it personally.
Yeah.
Obviously, Botox in teenagers is bad, and we don't want to state the obvious, but somebody who's having Botox every 6 months is absolutely fine.
Yeah.
But filler, there's different types of filler. And the hyaluronic acid filler, there's also different types of it. There's, I don't want to be too technical, but there are some fillers that they are more dense, and they absorb more fluid, and therefore contribute to facial swelling, which is going to be worse after surgery.
Yeah.
So if you have this type of filler, it's best to dissolve it in order to have a more predictable result and make surgery better and recover quicker. And but there are other types of filler, such as biostimulators, and not really fillers, that you can't really dissolve them. So Sculptra and Radies, and I know that surgeons, including me and myself, we're not big fans.
No.
But we don't really dislike it because of the results. Some people get good results. We dislike it because we have to go through scar tissue when we do the surgery. I'm not saying that Sculptra, there'd be people that have lovely results from Sculptra and Radies, and but when they come to surgery, then I know that it's going to take me a long time to go through it.
Yeah.
Still doable, but more difficult.
It's difficult. And what about you? I know I've spoken to you about this before, about hyalazing filler and what that does to the SMAS.
Yes. I just gonna be brutally honest. I think there's myths out there that hyalase destroyed my face. I mean, hyalase has an effect on the tissues, but it's a temporary and irreversible effect. What people are seeing from hyalase is the result of aging that they haven't seen because they had filler for a certain time, and the result of deflating the tissues that they've been inflated.
Sure. I see.
It's not hyalase per se
so
that does the damage.
Yeah.
The hyalase, it will dissolve some normal hyaluronic acid. However, your body will build it up again. Is your experience any different?
No. It's good. It's just I thought that there was maybe some impact that hyalase might have on the SMAS layer where it creates holes or something.
No, it doesn't. No, it doesn't. And I think if you ask surgeons, I mean, if you just overdo it and you just everything in moderation, but if you use a small amount, and we used to use hyalase, you have to go plastic surgery background. We were taking skin grafts and we're using as a diluting agent to facilitate the absorption of certain infiltration and also make surgery easier. And I used it in facelift surgery. I was just injecting it under the skin, and I was making a mixture with including hyalase. And I stopped using now, not because of clinical reasons, just because people we freak out. They say, "Oh, you use hyalase." And I think people have seen the results of having a lot of filler in the face. Then this filler was dissolved, and it looks bad in the first 2 weeks. But if you take the 2 week post-op compared to what you had before filler, hyalase will not be responsible for the changes.
Yeah, absolutely.
I suppose we get such warped ideas about our aging faces, don't we?
Yes.
With and without.
Yes, I think people always trying to find a reason why this has happened, and we keep forgetting that we continue to age.
Yes.
What we had 2 years ago, it's not going to be the same. So you just come back and say, "Well, this is me before the filler." When was the filler done? When you started 3 years ago, and that's me after hyalase. Well, you were 38, now you're 41.
That's right.
This thing got worse, and obviously the filler. But I think scientifically, and if you look at the pharmacological properties, they will say hyalase is has a reversible and temporary effect. It doesn't damage the tissues.
Yeah, absolutely. And in terms of people in the media and celebrities and things that have had, that you think have maybe had good deep plane facelifts, is there anybody that you think has done it well?
Dare you say?
Yeah, dare you say?
I think there's loads of them.
Yeah.
I'm not going to give names because I think
Afterwards.
yes, but I tell you, everyone who looks good has had it.
Really?
100%.
Yeah.
If you see somebody who turns up and they are 55 years old and you look at the jaw, I was looking at one of the on the Cannes now, just like and I was looking at the female actor that she turned up just here now, the cub, and it just popped out on my news, and I thought, oh wow, she had an amazing job.
Interesting.
There's no question. And if I ask, I think 100 people, 95 will say, oh, she's naturally so beautiful. Yes, she is, but not 55. You can't have this jawline.
I want a list after this. I want to know.
I can give you some.
Where do you see your work going over the next decade?
Oh, good question. I think if you think that you reach the level where you've learned it all, I think you're about to retire. I'm not in this phase in my career. I'm learning, continue to learn. I'm changing techniques. It's the details that make the difference. I know how to do the surgery, but there are still some details that I like to improve. Therefore, I am very active in terms of going visiting other surgeons. I'm now going to ISAPS in Cartagena next 10 days for a week. Following that, I'm going to go as a delegate, not teaching on a course where the other famous facial plastic surgeon, which cost about $10,000. And some people ask me, why did you go there to pay all this money? And even if I take two small things and get better, that's going to make me happier. So I can see myself having a practice where I can treat nice people and I can be a little bit more selective about who I want to operate. Not want to operate, on only, people that they are the perfect candidates. I like to help people, even if they're not really, you see somebody said, wants a deep plane facelift, she has a little bit of problem with filler. I think I'm the man for the job. I'm thinking I like complex surgery, so I'm happy to do it. But I would like to have consistency 100%. And this is where I am now. And I think when you reach this level where, you see a good result and then your next better result is the one that you've done next week, then you just being consistently better and better, and you can take the 7, 8 out of 10 and make it 8.5, 9, and sometimes 10 is a bit difficult, but I see myself as having a practice where it's dedicated to facelift surgery. I have a balanced life that I like. I'm not chock-a-blocked with patients because I can make a lot of money. I don't like that. I like the idea of having a boutique practice. I like people to feel like exclusivity having surgery with me, and I like them to feel like they feel safe, that they're going to be looked after. And this is where my aim is, because it is a big surgery, and just because I can put the prices up and I can do 2 a day and I can operate 4 days a week, it doesn't mean that it's a healthy thing. And I think surgeons that have done that, they made a lot of money, but they've lost something. I don't want to be greedy.
That's beautiful to hear. I love hearing this.
Thanks.
So George, if people want to get in touch with you, where can they find you?
Oh yes, they can find me. I mean, if you the quickest thing, to be honest, is my website, orfaniotis.co.uk. But you can go on Instagram, and there's a contact button, and there's options: email, call, WhatsApp. Just pick up what is what works for you, and just press the button there. And I like to see people that I have given them some information first.
Yes.
So if people can send me some pictures. And I can say, yes, you're a good candidate. I don't want to waste your time. And you pay the consultation fee. And you come to say, oh, sorry, I don't think I can help you. So I just like to make good use of my time, people's time, and have a nice consultation, 45 minutes. Spend a lot of time with me, and I have a good team of people that you're gonna feel straight away that there is a team specializing in this thing.
That's great.
Wonderful.
Thank you.
Great. Thank you, George.
Thank you so much. What a
great.
pleasure.
It really was.
Great. Thank you. Thank you guys. Thanks for having me.
Yeah, pleasure. So that was George Orfaniotis. He's a facelift surgeon. You can find his website at orfaniotis.co.uk. He's on Instagram as well. So check it out. Thanks for listening to Face Values. You can find my website at drdavidjack.com or forward any inquiries to my Instagram, which is at drdavidjack. We also have a live masterclass series that you can sign up to on my website as well, where you can get a chance to ask me any questions that you want to directly. It's usually done one Tuesday night every month, so I hope to see you there. And don't forget, if you've liked this, to subscribe on any of the podcast channels that you subscribe to. Thanks.